Hi, I'm Dr. Robert Dubin in Venice, Florida. Welcome to Endocrine for You. Today we're going to discuss the hallmark of diabetes, which is hyperglycemia or high blood sugars. Diabetes mellitus in the Greek language means sweet urine, and ancient physicians such as Hippocrates and Hippocrates would actually have to taste the urine of their patients in order to determine if they had this condition. Thank goodness we don't have to do that anymore. So before we get started, I want you to know we're in the office today at Millennium Physician Group in Venice, and you might hear some background noise, so bear with us, but this is where we work, this is where we see patients, this is the lab. So here is our outline for today's video brochure. Number one, we're going to define what hyperglycemia is. Number two, we're going to talk about why it happens. Number three, we're going to talk about the complications of having high blood sugars. And finally, we're going to wrap it up with how do we treat this condition in a very broad sense. Remember our caveats that these video segments are never replacements for your boots on the ground personal providers that take care of you on an everyday basis. These are just simply a way to learn, to enhance your own involvement, and ultimately get better control of your endocrine-related health problems. Deal? Good deal. All right, so what is hyperglycemia? It's important to realize there's a distinction between the definition of what is a normal blood sugar in a laboratory in the United States and what constitutes what we would call high blood sugars in our patients with diabetes. What I mean is that if you have a blood test done at Quest or LabCorp and the fasting glucose is between 101 and 125, this is considered to be pre-diabetes or impaired fasting glucose, while a fasting blood sugar over 126 is considered to be in, quote, diabetic range. For the sake of most patients with diabetes, particularly in patients that use continuous glucose monitoring systems, a blood glucose greater than 180 is kind of that top end and considered out of range or above range. The American Diabetes Association suggests that patients with diabetes try and maintain a fasting blood glucose under 130, maybe like 80 to 130, or a 1 to 2 hour post-meal glucose of less than 180. You can see how complicated this is. I like to stick with the ADA recommendations for fasting less than 130, 1 to 2 hour post-meal less than 180 for most of my patients. Okay? What causes hyperglycemia? This gets kind of complicated, but I'm going to break it down to the real basic sense, because remember the apothecary scale. You've got glucose or sugar on one end, insulin on the other, and you've got a lot of interplay there. Hyperglycemia that occurs in patients that have diabetes can differ in patients that have type 1 versus type 2 diabetes. I have a lot of patients with type 1 diabetes that are known to have, quote, brittle diabetes. That means their blood sugars bounce around up and they're down 1 second, they're up the next second. And then I have patients with type 2 diabetes that are real stable. They just ride it out and they're just right there. So don't forget there's exceptions to every rule. There's another concept known as advanced glycosylated end products. This is the physiologic concept that explains why high blood sugars damage organs such as the kidneys and the eyes and the nervous system. So that's a pretty cool topic that we'll hopefully cover in another video brochure, Ben. Ben, got it, Ben? Come on. He's there. Okay, so in a very simplistic sense, having high blood sugars can cause acute complications known as diabetic ketoacidosis, and in rare cases, an entity called hyperosmolar non-ketogenic coma, usually in like nursing home patients. Diabetic ketoacidosis usually occurs in patients with type 1 diabetes after they've exhausted all of their insulin stores and the body transitions to their primary fuel source, which is carbohydrates, and they convert proteins and stuff to that. We're going to talk about that later. That is not a ketogenic diet. Okay, so keep that in mind. The chronic complications, we've talked about these before. You guys know them, right? It's the heart, the brain, the kidneys, the eyes, and don't forget, cardiovascular disease, stroke or heart attack are the #1 killers of patients with diabetes. Okay, crucial. All right, when it comes to the question of how to best treat hyperglycemia, the answer is very complicated and it's variable depending on the source and the causes. The primary treatment for all patients with diabetes involves lifestyle modifications through diet and exercise. Before 1922 and the discovery of insulin, this was the only treatment option we had. We would just stop eating carbohydrates, and it was an awful, awful situation for patients. The treatment of patients with type 1 diabetes is insulin-based because of the deficiency in insulin production from the pancreas. The cells have stopped making it. The treatment of patients with type 2 diabetes is primarily improving the ability of the body to use the insulin that they're making and to lower the insulin resistance, okay? In most patients with type 2 diabetes, I take a weight-centered approach. So as the weight goes up, sugars go up. Weight goes down, sugars go down. So keep that in mind. That's coming on one of our close videos here. Remember, the purpose of treating hyperglycemia for you with both type 1 diabetes and type 2 diabetes is to avoid the acute and chronic complications. This is kind of a hard concept to grasp for a lot of patients because they're going into their doctor's offices, they're looking at their numbers, and they're getting reprimanded, and they're feeling, like they're not doing a good job. Remember, this is all about reducing the complications. So I hope this information helps with your understanding of this very complex disease. More importantly, I hope that this knowledge will help to give you the tools that you need to optimize your treatments in order to avoid the complications from diabetes. So thank you for tuning in and watching Endocrine for You. I'm Robert Dubin in Venice, Florida. Take care.